And we use the funnel to understand who are all the potential users of your product, what portion of that total market that could use your product, what's the serviceable available market, what portion is accessible to you, are they available to you, what portion is available that will actually use your product. So sort of thinking to narrow that down. And you can cut this a bunch of different ways. You can cut it by disease type or physician access, and so there's ways to think about it, but you just need to be logical in your thinking. If you go into an investor meeting, or earlier we're talking that your tech transfer office might be your customer for this information, right? You go in and say, this is a $3 billion opportunity. $3 billion opportunity. This is probably not your $3 billion opportunity, okay? So we're going to do an example, product area that's close to my heart and my experience, a spinal fusion device. So it's a metal device that gets implanted into the spine to fuse vertebral bodies, yep. And it helps to basically reduce pain or reduce motion in the back. For this one, the spinal device is all people with back pain. Standing here right now, because I've been standing for a couple hours, my back's hurting. 75% of people in the US, probably worldwide, have back pain at some time in their life. So all those people. So think about what's that total market? What's that big piece of the funnel that you're going to start to approach? And as we go through, feel free to write notes on your worksheet as we go through this. What's my available market? What's the portion that has disabling back pain? I do not have disabling back pain. I live my life. I take some drugs every now and then. I do some stretching, go to a chiropractor now and then, exercise. I'm good, okay? Of those patients that are available, how many of them access to a spinal surgeon? Yeah, right. A surgeon that can implant this product for them and help them. And do they have the insurance to pay for it? And then from there, which patients are in a serviceable available market? They've also failed conservative treatment. They have this disabling back pain. They have a treatable disc herniation. So you start to narrow in a little bit more on who those patients are, what's happened to them already, and are they able to get advice from this surgeon who they can pay for, from their consultation, to be the person that sort of pops out the end as someone that actually needs a spinal fusion. So think about that as we're talking about market sizing. You're narrowing your funnel from the big macro world of the patients that you're dealing with and narrowing them down. Some of the filters that might be used here are previous treatments. They are, this happens in clinical trials a lot, where they say, if you have had this other treatment before, you're not allowed to use this product now, because it could influence the outcomes of the treatment. And so, think about what other products could be counter to the efficacy and availability and usefulness of your product for those patients.